Hello, welcome to RC-558, Special Topics in Rehabilitation, Rural Rehabilitation. My name is Dr. David Beach and I am adjunct faculty here at the Graduate Program in Rehabilitation Counseling. And we're going to be discussing a topic near and dear to my heart, which is the provision of rehabilitation services in rural areas of the United States. And the reason that this is a subject that is near and dear to my heart is because I'm from a rural area. I was born and raised in a small town, largely agrarian area in between Cincinnati, Ohio, and Lexington, Kentucky, and then spent a large amount of time working at a state-operated comprehensive rehabilitation center in the foothills of Appalachia in eastern Kentucky. So growing up in a small town in a rural area, again, it was part of the Burley Belt, or a large tobacco growing area at the time, gave me a real good insight as to what it's like to live and be in that kind of environment, the uniqueness of that environment, the challenges of that environment, and then working in that environment when I moved to eastern Kentucky gave me a good sense of the difficulties in providing services. We were in a rural area. We worked with consumers from across the state of Kentucky, which is largely rural, and we had to provide services in a rural area and sending consumers back to rural communities where many times there weren't the necessary support services to maintain or support what we had provided or the training that we had provided while they worked at our facility. So I've always tried to be a champion of expansion of services usually provided in urban areas or metropolitan areas, and make sure that the quality of the services provided in rural areas is up to par and provides that critical need. And we'll look, when we start talking about population, at why that's so critical, rural areas. Please make sure you have reviewed the syllabus and you have looked at all the assignments, the tests, and the quizzes. Make sure you know the due dates for all those, and if you have any questions, please contact your instructor. For the first part of this class, or the first lecture here, we should be available during this week's materials is the PowerPoint Population Dispersion and Incidence of Disabilities in the United States. So please access or grab that PowerPoint and have that handy, or please be reviewing this, because I'm going to be working from this largely in this lecture. The first thing we want to do, because rural means a lot of things to a lot of people. A lot of people think they grew up in a small area or a small town, and rural looks like different things across the spectrum when you're talking the United States. You know, there's a lot of different characterizations or classification of how the U.S. government looks at various areas in terms of population size and how those are categorized. And just so we're all working from the same base, what I want to do with this initial part, the first part of the class, is make sure we understand what rural looks like and how it's defined. And we'll talk about why that's important, why it's important that various areas are classified as rural, metro, urban, etc. So looking at the slide number 2, we'll talk a little bit about the U.S. Census. And just so you understand, you know, there's a census conducted every 10 years. And that's required by the Constitution, which requires a census or a polling of the entire population of the United States as I said earlier, every 10 years. Now also you will see the American Community Survey, which, because we need data more than every 10 years, the American Community Survey utilizes some sampling plus some of the 2000 or some of the census data, and kind of extrapolates the data using various statistical strategies, and comes up with updated terms-based or updated statistics based on the trends that they found. So I'll do the best I can throughout the lectures to identify what is census, any census data, and what is American Community Survey data, because generally if you see American Community Survey data, it's more up to date, but it may not be as reliable because it is a sample that has been sort of it's a projection. So but when we look at, in terms of the census, we're just looking at the classifications right now. The classification for a metropolitan county, or the definition of a metropolitan county, is a central county with one or more urbanized areas, each having a population of 50,000 or more residents, plus any outlying counties in which at least 25% of the working age population commute to the central county for work, or in which 25% of the outlying county's workers commute from the central county. Now, the key word in this definition is county. Okay? This is defined by county lines. So in a state like Kentucky that has 120 counties, very small, this can affect the classification, where you go to other states that are bigger in area, bigger in nature, just in square miles, that may make them appear to be larger in nature, because their county square footage is bigger, or square mileage is bigger than smaller counties. So, but that's how the census defines a metropolitan area. It's not just looking at the population of the central county. It's any county that surrounds it that where at least 25% commute into that metropolitan county or commute out of that main central area. A non-metropolitan county is generally defined in two ways. The first kind is a non-metropolitan micropolitan, which is it has one or more urban clusters, and we'll talk about what an urban cluster is in just a minute. But it's towns basically between 10 to 49,999 persons. It can have more than one county, and it looks a lot at the commuting patterns. In some cases, you may have a town or a county that's adjacent to a larger area, but there may not be, for various reasons, a lot of commuting patterns, which they actually do track in some of the sample and some of the surveys that are conducted with the U.S. Census and the American Community Survey. Non-metropolitan, what they call a non-core counties, contains no town of at least 10,000 people. So a lot of your studies, you'll see non-metropolitan, non-core counties as a classification. That's generally what they'll refer to as rural. Now, you'll also see it below, when you start talking about urban and rural, there are definitions, but generally most of your research is conducted based on metropolitan, non-metropolitan, micropolitan, or non-metropolitan, non-core. And when we look at the definition of urban, it's a densely settled area with a population of at least 50,000. So it really doesn't matter the size of the county in square miles. It matters more about how dense the population is in any given area. An urban cluster is a densely settled area with population between 2,500 and 49,999. So it's not really, again, not about a county. It's just where are the individuals located in terms of distance between each other. A rural area is an area outside these urban clusters with a population less than 2,500 persons. Non-urbanized. The Department of Transportation, which it's important in this case because a lot of grants to urban and non-urban areas are provided, especially related to transportation and roads, is determined by the Department of Transportation definition, which uses 2000, uses census, but it groups them a little bit differently. It says anything between 2,500. It just doesn't really include urban clusters, so it looks at anything between 50,000 above is considered urban. Anything below that is considered rural. So when you're reading data related or research related or grants related to this, it's important to make that distinction. Slide 3 is just an expression or a map of metropolitan, micropolitan, and non-core counties. So the lighter the area, the larger grouping of people, the more gray, then the smaller the population. And we're going to talk, I want to talk a little bit this after we look through all these maps. But you can look and see on there where your area is and whether or not it's considered metropolitan, metropolitan, non-metropolitan, micropolitan, or a non-core. From now on, we'll just call them metropolitan, micropolitan, or non-core. The next slide 4, you can see the urban clusters. The blue or the darker areas are actually the urbanized areas, the urban clusters, and then what they call rural America. The blue or the darker clusters are the urbanized areas. There's some sporadic other dots that are supposed to be green. On my computer anyway, they don't show up real well, but they're the little dots that are dispersed throughout the country there. And then the rest of the gray is what they consider rural America. So if you looked in terms of people, where people are, that's what it looks like. And the next one is urbanized areas and urban clusters by metro and non-metro counties. So this is sort of a combination of the first two maps and some things that I would like for you to kind of focus on while we're on this map is this dispersion of the population of the United States and the problem inherent with our country when developing national policies. Because you can see the bulk of our population is actually sort of on the eastern seaboard and on the eastern half of the United States. Pretty much, I'd say that's probably the Houston and Dallas, Texas east. You see a smattering, you see most of the blue urbanized areas. Then, when you go west of that area, you see very little urbanized areas through there and a lot less of the population. But when you develop national policies and you try to provide services to the entire United States, you have to be able to provide those services not only in those urban areas but in all those rural clusters or all those rural areas that are spread throughout the United States. And you can see there's much more of the country that would be considered rural or non-metropolitan, and very few areas of the country that are actually urbanized. So just take a minute, make sure you understand these maps and look at your state if you have rural areas in your state, and look where the urban areas are in relation to the rural areas, and think about how the difficulty and how the distance from those areas and how that might impact people with disabilities that live in your state or in your area. Okay, on slide 6, we're going to talk about some some in terms of population. This is American Community Survey data. Right now, based on this data, the United States population is 304,059,728. The per capita income in general is 38,615. Per capita means that each individual, it's basically population divided by number of working persons is roughly 38,615. So that's roughly the earnings of every individual. Poverty rate is 12.9%. 18.8% of our population has not completed high school. Unemployment, and you can tell this is a little older data, is 5.8%. After the recession, that obviously rose a little higher. But when you look at the same data in terms of population in rural areas, 70,553,857 persons live in rural areas. The per capita income is only 28,781. So that indicates that income per year is much less for persons living in general in the rural portions of the United States. Poverty is 15.1%, which is significantly higher, and 23.5%, and that's almost a quarter of the population of rural America has not completed high school. Unemployment, though, is a little smaller, and we'll talk about that a little bit throughout the class. Sometimes we deal with statistic anomalies. Actually, we can talk about it now. Unemployment may be lower, but unemployment numbers, as you know, or as many of you probably know, are based on those that are actively looking for a job. And in rural areas, this may be underreported because many individuals may not be reporting that they are actually looking for a job, or they may not be seeking employment. Just in general, if you wanted to say what does the rural population or the non-metro population look like? Well, it's older. It's less likely to be from a minority group and has lower education and income levels than the metro population, and we saw that earlier. This is an issue, and you can see we're on slide 7, because higher socioeconomic status, including education, income, and non-minority status, tends to be positively associated with health status. So if you have a higher income, have a higher education, you have a tend to have a higher in terms of where you are in your assets, the amount of assets you have. If the higher or the more you have of that, you tend to be healthier. So the concern we have in rural America, there's more in poverty, lower income, and then because of those issues and the lack of education, which impacts their ability to increase their income, then that will have a negative impact on their health. And other data we'll look at in other lectures will sort of illustrate that. Moving on to number 8, or slide 8. The census defines disability. It looks at disability, and that definition is provided here on slide 8. It looks at, it reports any person age 5 or older reporting a long-lasting sensory, physical, mental, or self-care disability, or a person age 16 or older reported difficulty going outside the home because of a physical, mental, or emotional condition lasting 6 months or more, or 3, a person aged 16 to 64 reported difficulty working at a job or business because of a physical, mental, or emotional condition lasting 6 months or more. So that's how the census defines and pulls data from the 10-year census. If we look at, and you can see in this slide, this is actually census data. So the numbers are a little bit different in terms of total population. We're on slide 9 here. But I want you to focus more on the percents with a disability, because that's going to be the key aspect. We talk about the United States. In the 2000 census, the total population was 281,421,906. When we talk about the number of civilian non-institutionalized persons 5 years and older with a disability, 49,746,248. So 19.3, roughly 20% of the nation has a disability. But when you look at the metropolitan areas, that number, that percentage, even though it's a high number, 40 million, but that's only 18.9% of the population. But as you work into non-metro and areas, that's 21.7% of that non-metro population. If you break it down even further, micropolitan areas, which are non-metropolitan areas, they're 21% of their population with has a disability. And then if you look at non-core, which are truly your rural areas, they're up to 22.8%. So in a town of 1,000, 228 individuals will likely have a disability. So that's almost a quarter of your population requiring, has some kind of disability that probably requires some type of service. So, when you look at, even though it's a large frequency number in terms of metropolitan, it's a smaller portion, and they have larger tax bases to support that smaller portion and therefore provide services to persons with disabilities. Your non-metro areas don't have that tax base nor those resources to provide that services to the citizens who likely have a little bit greater need. Slide 10, we talk about, again, rural, civilian, non-institutionalized individuals. It looks more at those same numbers, and you can see that the numbers are much more higher in non-core counties in rural areas, similar to the last slide. I think slide 11 is interesting. This comes from the I think the Montana Institute for Rural Rehabilitation, and it's a little blurry, at least it is on my screen, but it provides sort of the dispersion of persons with disabilities based on the census. The lighter the county, the less number of persons with disabilities, and as it goes through, up through yellow and then green and into blue and purple, there are higher incidents of persons with disabilities, and you can sort of see some high populations, especially in, now you will see one of the problems with some of this data is that a lot of times persons with disabilities are older. So places like Arizona, Southern California, a lot of your waterfront areas, because those are retirement communities, they'll have older populations, and therefore you'll see a little bit more of a higher incidence of persons with disabilities. But you can again see how people with disabilities are dispersed across the United States, and that even as we get out west, there are still decent clusters and decent amounts of persons with disabilities. And when we compare that to the first couple maps we showed based on the urban clusters, there just aren't there isn't the amount of population to provide to provide the tax base to provide services, which makes it very difficult. And there's a lot of resources, which we'll talk about in later lectures, that make providing rehabilitation services difficult for people with disabilities. This looks at the percent of this next slide, slide 12, looks at the percent of people aged 5 and older in the civilian non-institutionalized population with any disability by county. So if you can't read the chart down here, the lighter is the lower population with a disability, and as it gets progressively darker with that dark blue, that is the higher percent of disability. And I believe it says 25, I think that's 26.5%. And you can see there's a cluster. If you're pretty good at geography, you can see as you start up in Michigan and you move south into Ohio, and then you get down into Appalachia, there's a very dark cluster there where all those counties in that area are have higher than 26.5% of their population has some type of disability. And you can see the farther into the south you go, you see large clusters of disability population. And then as you go sort of northwest, the population sort of disperses a little bit more, and then, you know, of course, on the western part of the United States, you have a little bit higher incidence. But you know, generally anything, you know, the average is anything sort of, you know, in that green area. And you look, and we saw earlier where in the northeast, in the earlier slide, I think 3, 4, 5, when we looked at the urban areas, you can see up in the northeast that in terms of percent, the population is higher, and there's a lower percent of persons with disabilities. So what that means is they have a higher tax base, and they have, you know, there are more individuals, and as far as their citizenry, there are less people with disabilities in terms of percentage. So there's more resources, therefore, to provide them services. They're sort of less encumbered as opposed to some of the areas where the percentage is higher. What does this mean? Why is this important? Again, I've talked about in terms of population funding base. The larger your area, the more persons who pay in through property taxes, income tax, occupational taxes. All those support excuse me, programs that provide valuable services, valuable human services to persons with disabilities. And if you have smaller percents of population, you have more resources, and you don't have as much stress on the system. When you look at your rural areas, they have higher percentages of their population that have disabilities without that tax base, that important tax base, to provide services, provide necessary services, including all of the other services that these areas have to provide. You know, rural areas, working with persons with disabilities and poverty is just not their only struggle. They have to provide adequate roads, and they have to provide other adequate county services. When you talk about definitions, important is that many grants and funding sources target specific areas and regions. A lot of times you'll see a grant come out that says that it is for a rural area or a non-metropolitan area. So it's important what that definition means. If you're considered a micropolitan or a non-core area or an urban cluster, all those are very important when it comes to terms of funding. Various government programs have different definitions of rural, urban, metropolitan. We talked about that, and in some cases they can, we talked about transportation sort of lumped places between 2,500 and 50,000 together, where the census didn't. So transportation may give a rural or a non-urban grant to a town with 49,000 people that was really, when it was conceptualized, meant for a much smaller area. So that's why that's important. When people fill out grants, when they apply for grants, these are considered, but and a lot of times it's need-based. The last part of slide 13, which I discussed earlier, is the census versus the American Community Survey, and that's important. And if you're going to work in some kind of federal or state-supported program, it's important to understand how the census works and how that impacts your funding. For example, if we talk about the public VR program, that's based on census data. As well as a lot of other factors, but the bulk of it is, the bulk of the funding formula, as well as the independent living portion of that rehab funding, is based on the number of people. So, very generally, and there's a lot of other factors, but generally, the less people you have, the less federal funding per person, or less federal funding total that you receive, giving you less resources to access. Now, in terms of disability funding, the thinking is, well, you don't have as many people, therefore you don't need as much money. But in a rural state like Kentucky that I pointed out, had a large cluster of a high percentage of its population, or West Virginia or parts of Virginia, that have such a high percentage of their population were given less money, but there's a greater need than there was in those urbanized areas such as the Northeast. So that's why that data is important, and it's important that you understand the impact of the census and the American Community Survey on the public VR program or other programs that are state or federally funded. Okay, wrapping things up, most of this data came from, and we will post these on, and you'll see this at various points throughout the course. We will post these and have you get the opportunity to click these links and look through some of the other maps that are available on the University of Montana Rural Institute. The U.S. Census Bureau has a lot of great information about, you can look at state-specific information. You can break it down into metropolitan, non-metropolitan, micropolitan. There's a lot of great data on the U.S. Census Bureau that you can look at your state and get a general understanding of how the census views the population breakdown of your state. And then lastly on this page is the Rural Assistance Center, which just provides some general information about life in the rural America. So with that, we will conclude this lecture. Thank you.